On the variants, you have the South African one that's getting attention because it's seen as more infectious and resistant to vaccines. That's here in the U.S. Meanwhile, a top epidemiologist who advised Joe Biden is offering this warning about the British strain today.
The surge that is likely to occur with this new variant from England is going to happen in the next 6 to 14 weeks. We are going to see something like we have not seen yet in this country. I see that Hurricane 5, Category 5 or higher, 450 miles offshore. And, you know, telling people to evacuate on that nice blue sky day is going to be hard. But I can also tell you that hurricane's coming.
Does that sound right to you, or is it possibly overblown?
Well, let's put it this way, that certainly that is a possibility. But I think if we do the things that you and I have just mentioned a moment ago, that doesn't necessarily have to happen. So what Dr. Osterholm, who is a good friend, is saying, he tends to think in terms of the worst case scenario. Now, the worst case scenario may occur, but I think we have the power within us to do things to prevent that from occurring. So if you get a dominant strain, and he's quite correct in saying that if you do modeling, the UK strain, which is the B117, which shows to be more transmissible in the UK, leading to their surge, if it becomes dominant in the United States, we will be challenged with a virus that has a degree of transmissibility that's more efficient than what we've been dealing with. And because of that, that should be an impetus for us to double down so that uniformly, not spottily, but uniformly throughout the country, that we do have a degree of adherence to those measures that we know work. So he's correct in saying that this is a possibility, and it might be, but I think it doesn't have to be an inevitability, a possibility, but not necessarily an inevitability.
That's, if I may say so, that's very Dr. Fauci, the way you're putting it. You've also said herd immunity would be getting somewhere around roughly 75% vaccination rates. If, though, these other variants spread enough, does that prior advice hold, or does it become more complicated?
Well, that's very interesting. So it gets a little complicated, but I think I could simplify it. I've said that, and this is purely an estimate because we don't have the data to prove it, but I think it's a reasonably accurate estimate that if we get 70 to 85% of the population vaccinated, that we will, in fact, get a degree of herd immunity, which would be represented by kind of an umbrella or a blanket of protection so that the level of virus is so low that it is not threatening anymore. Now, the point is that if you get these variants that dominate, the ones that you need to be concerned about more so than the British one is the one in South Africa. Because the one in South Africa, which is 351, that's just the name of the lineage. We don't like to call it by the country. It gets to be a little bit almost stigmatizing the country, which we shouldn't be doing. But if that becomes dominant in the country, it tends to evade the efficacy of the vaccine somewhat. So it might be that it would spread more rapidly. That's the sobering news. The news that is a bit encouraging, that the data that we saw from South Africa with another vaccine, namely the J&J vaccine, that even though it was actually not 94 to 95% effective, it was only about, I would say 72% effective overall, but it did protect very well against severe disease leading to hospitalization and death. So what we could see, if that becomes dominant and we don't have time to upgrade the vaccine, which we're working on already, trying to upgrade a vaccine to directly address the new mutants, we may see a situation where we have more infections, but if the people get vaccinated, the overwhelming proportion of the people get vaccinating, that you have the unusual situation of a lot more infections, even if you're vaccinated, but very fewer people getting serious disease and dying. Is that clear? I mean, I think that's important because it can be confusing.
Well, when you say it, let me say it back to you as a layperson, not the expert that you are. It almost sounds like you're saying the public health benefit would be something that we more associate with treatment rather than vaccination, in the sense that you're going to have at a collective level less of the most extreme, severe, or deadly result, which is a collective good, even though it doesn't. Right. Go ahead.
Yeah, no, you're absolutely correct, Ari. That's exactly what they saw when they tested, and then it's another vaccine. It's the J&J vaccine. When they tested it in South Africa, the prevention of infection was markedly diminished. When you were talking about mild to moderate disease, it was like 57 or so %. But when you looked at severe disease, it was about 88% protection. And when you're looking at hospitalization and death, it was almost 100% protected. So it was this interesting situation where you have a vaccine which in the classic sense was not preventing you from getting infected or even mildly ill. But what it was preventing you from doing was getting extremely ill and dying. So that's the thing, that's the difference there. So we would
No, I think that, well, Doctor, what I was going to suggest is that's such an important point. I hope that sinks in with people. It's also a reminder of why so much of this science, which you've encouraged everyone to follow, and which we have multiple companies around the world pursuing, can deliver more than one result. It's not a black and white result that's so simple to digest, but it's something that we need to follow. Hey, I'm Ari Melber from MSNBC. You can see more of our videos right here, or better yet, subscribe to our YouTube channel below. You could have been anywhere in the world, but you're here with us, and we appreciate that.